Hello, everyone. This is Dr. Alan Simberg. And in today's video, I'm going to talk about the effect of our thoughts and words and how that effect can actually have an influence on recovery from addiction. And when I'm talking about thoughts and words, I'm thinking that it's not only what's in your mind, but it's also what you say. And the next part of that is we can think or have words about ourselves. We sometimes talk to ourselves, and sometimes we either have thoughts or we talk about how we think or talk about someone else. So, when I'm talking about effects, what I'm referring to is either productive or positive or helpful effects, or negative or counterproductive thoughts and effects. Obviously, the productive and positive thoughts can be very helpful in your recovery journey. The negative and counterproductive thoughts and words can have a negative effect on your recovery journey. So, the first thing to keep in mind is the difference between judging and assessing. When we judge, we make something right or wrong, good or bad. It's very black and white thinking. When we assess, we think about either what did happen that we didn't want to have happen, or what did not happen and we wanted to have happen. And then we think about what contributed to either of those results. And then we think about a solution. Either what could we have done better, or what can we do better? The next part of this to consider is the difference between labeling and describing. Again, when we label something, we make it right or wrong. When we describe it, we describe what we're seeing. So, simple example would be if we drop something and we label it, we might say or think, oh, I can't believe how stupid I am. I can't believe I dropped that. Oh, look at the mess. Or we can assess it. We can just say, well, okay, drop that. I know how that happened. Guess might as well just clean it up and go on. And then the next part to consider is the difference between reacting and responding. When we react, we have emotion. When we respond, we have emotion, but we manage that emotion. So judging, labeling, and reacting go together, and assessing, describing, and responding go together. So, what does this have to do with recovery from addiction? Well, specifically, if our thoughts and our words, regardless of whether we're thinking about ourselves or someone else, can either have a helpful effect on our recovery or it can have a negative effect. And it's really important to pay attention, become mindful of what you think and say. So I'll give you an example. So let's say, for example, you're in recovery from your addiction and you relapse. Well, if you judge it and maybe label yourself it could contribute to you feeling guilt and shame, and that could keep you in your relapse. However, if you describe and assess it, you could say, well, okay, I relapsed. What caused me to do that? It doesn't undo all the recovery that I've been through so far. It just sort of interferes with the progress at this point. So now what am I going to do? And then you decide what you're going to do about getting back on the road to recovery. So I hope that you're able to see from what I've described that your thoughts and words can either be helpful or can contribute to something that's been happening continuing. It's important to stay mindful and certainly helpful to stay mindful of your thoughts. And let's say, for example, maybe you do label, maybe you do judge. Don't focus on the fact that you did that. Just notice it. See, that's where mindfulness comes in. Being aware of the present moment and what's happening in the present moment. Just be aware of it and let it go and move on to the more productive, positive thinking and thoughts. One of the things that's also really important while you're on your road to recovery, and even maybe if you do have a relapse, is never give up. Always do your best to either maintain progress or resume progress on your road to recovery. In my next video, I'm going to talk about the relationship between stress and relapse and how managing stress can actually contribute to the most consistent recovery possible. And I'll even provide a few tips on how you can manage your stress so that it doesn't become distressful.